Hi, everyone, and welcome to the Wholistic Matters podcast. This is the Wholistic Approach to Pet Care, and I'm here with certified veterinary technician Jody Griffiths.
Hello to all of our veterinary professionals and pet parents. Today we're going to be talking with Dr. Laura Gaylord about the role played by omega-3 fatty acids in veterinary practice.
All right, so we're happy to be here today with Dr. Laura Gaylord, and we're really going to be focusing on omegas and the benefit of omegas for the body. And so before we jump into some of this great information, Dr. Gaylord, would you mind introducing yourself and telling us a little bit about yourself?
Yeah, certainly. Thank you so much for having me today. I am currently a board certified veterinary nutritionist, but I also have been a general practitioner for a very long time, going on 25 years. Doing practice first was my passion. I worked in a couple large animal hospitals, also did some relief work, but then decided to chase my passion of nutrition and do the best job for my patients. So I did an alternative tract residency. So I kept my day job and I did nutrition on the side, squeezing that in. And so now I have transitioned to 100% nutrition practice, providing nutrition consultations for my patients. I do homemade diet formulations through petdiets.com. And I also do supplement work, working with companies big and small, trying to just get the best supplement products out there, the safest ones for our pets.
Great. So like I said, today we're really going to be focusing on omegas and the benefit of omegas, especially omega-3s for our pets. And so let's start off by talking a little bit about what makes omega fatty acids essential for dogs and cats.
Okay, well, great. Omega-3s, all the omegas are really, really important. I'm actually personally a big fan of omega-3 fatty acids. I use them really quite often for all of my patients. What makes them essential in the diet is essential nutrients are those that we cannot make, our bodies cannot make on their own. And so they have to be supplied in the diet. And so we do have some essential omega-6s, particularly linoleic acid for both dogs and cats, but also arachidonic acid for cats. And then in the omega-3s, we have some requirements for omega-3s for growth and reproduction, alpha-linolenic acid. And then, of course, DHA is docosahexaenoic acid is required for puppies. And we need it for both brain development and retinal development. And it's also important for reproduction. And so these are the essential requirements. But of course, we can talk about optimal requirements or optimal health as well.
So if we're looking at the effects of the omegas and if there's any deficiencies in the body, where can we expect to see that in some of the animals?
Yeah, it's a really good question. So if we're not getting enough, if our diet is not supplying enough of either omega-6 or omega-3, there are documented deficiencies that we can see. For omega-6, for especially young puppies, we might see abnormalities of the skin and the hair coat. Omega-6 functions in that epidermal water barrier, so it protects us from losses. And so this is where I think about the puppies coming out of the shelters with real scruffy hair coats. They've been on really poor diets. They may be itchy. They may have secondary skin infections. We can also see reproductive problems or just a general failure to thrive if we don't have enough of the omega-6s. And then for the 3s, omega-3 is really important in neurologic development. So for those that are not getting enough, we might see polyneuropathies or deficiencies in learning as they're developing. So, we definitely make puppies smarter by giving them enough DHA in their diet. And this is why there is a requirement for that. It's also important for visual performance. So having optimal retinal health, we're going to want to have enough omega-3s in the diet.
You hear so much information about the ratio of omega-6 to omega-3s. What is that optimal ratio in the body?
Yeah, that's a really good question. I honestly think that the optimal ratio has not been nailed down 100%. The requirement for it, or recommendation, I should say, that has been provided by AAFCO, the Association of American Feed Control Officials, is really 30-1. So that would be 30 on the omega-6 side and 1 on the omega-3 side, which is actually quite low. I mean, we feel like that's a low amount of omega-3s that would be coming in. Newer research is showing or recommending maybe we need to get that much lower. So maybe more like a 5-1 ratio. And that would be more omega-3s and less omega-6s. So we hear a lot about that in human health, how our diets are really high in omega-6. And that's true for pet foods too. A lot of pet foods are very high in omega-6s. So we're still working on that, but I think overall we can say we need more omega-3s in our diets.
You mentioned that pet foods are pretty high in omega-6s. Why is that?
Well, it comes in a lot of the plant-based oil sources in the diet. So in omega-6s are going to be coming from, canola oil or sunflower oil. If they're providing fats, basically coming from vegetable-based sources, and there's just not enough of the marine-based omega-3 sources typically.
And how about if we think about other pet food ingredients? I mean, if we're thinking about the protein that's maybe coming from cattle or from chickens, those food sources and what they're eating, is there potential for there to be higher concentrations of omega-6 as a result of that too?
Yes, definitely. I mean, if it's an animal that's not a marine sourced animal, so salmon as compared to like chicken or beef, it's going to have more of the omega-6s in there. And actually, when I formulate homemade diets, I'm using those ingredients to make sure I'm meeting the omega-6 requirement because I know they're a good source of that. But then if the diet becomes all chicken based, then we have lots of omega-6s and very few omega-3s.
So if we have this imbalance of the omega-6 to omega-3 ratios in the body, and we know that there is so much benefit that comes from the omega-3s, what can we be doing for our pets to make sure that we're helping to bring that ratio back into balance?
Yeah, so really that would require us making choices about maybe the ingredients. So if we're selecting a diet that would be more marine source, so fish-based is really the only best option. Otherwise, you're really looking at providing a supplement. So we're going to have to add a supplement on top of this diet in order to get those omega-3s where they need to be. Now, there are some commercial diets that will include supplementation in the formulation, but those are the prescription diets or the therapeutic diets. But it's good to have awareness of those diets and how much they contain. So also we have an idea of the total amount that we're feeding that pet on a daily basis.
Let's talk a little bit about the health benefit. You've touched on this a little bit. I mean, you mentioned some of the benefits of omega-6s and omega-3s, but I think even more specifically EPA and DHA. What are some typical cases that you would be thinking to reach for supplementing with omega-3s?
Yeah, so that's a great question. There's actually a lot of them. I can make a case for so many pets to be on omega-3 supplements because really we're targeting inflammation with our dosing, and so many diseases also have a component of inflammation as the issue. So this means immune disorders, inflammatory bowel disease, allergies, problems with skin and hair coat quality. Renal disease is another one. We think about higher dosing for cases that have just chronic kidney disease or even glomerulonephropathies or protein losses into the urine. There's actually a therapeutic dose recommended for that disease as well. I also use it for arthritis, another disease condition we commonly think of with a lot of inflammation involved. Heart disease, another one that we think of, we can see benefits with delaying cachexia, which is a wasting syndrome that we see with more advanced heart states, or we can prevent abnormal heart rhythms if we add omega-3s into their diet. So there's many indications for it, many different diseases we may be thinking about this.
And can we use it proactively? Do we necessarily have to wait until an animal is showing signs of disease state or compromise before we start thinking about using an omega-3 supplement?
Absolutely. We should be thinking about it proactively. I think by the time we have a disease state, we're at the maximal expression of inflammation and the damage has already occurred. And so now we're cleaning up the mess, essentially. So this is why the discussion about ratios in the diet, really that's proactive nutrition. We're trying to get the right amount in before the disease manifests itself. So definitely I agree with adding it in healthy pets diets as well.
So we know there's different levels of fatty acids, and from my understanding, we have omega-3 as an ALA, and then we have omega-6 as an LA, and then we know that it needs to be converted down to the next level, like EPA and DHA, in order for the body to be reaping the benefits of those levels of the fatty acids. And so how is that conversion rate in the cats and dogs? Is that something that we need to be thinking about?
Yeah, so that's a really important consideration. So we have these metabolic pathways in place, and we start with the parent molecules, and they'll go through a series of enzyme conversions to get to another molecule, which is considered the more biologically active molecule, the more important molecule. And so LA, linoleic acid, and ALA, alpha linolenic acid, are one is the omega-6 and the other is the omega-3. And those are converted down to their more biologically active molecules, linoleic going to arachidonic or AA, and then alpha linolenic going through into EPA, and then finally DHA. So dogs and cats are different in their ability to convert those to the more biologically active forms. We know that cats do not convert linoleic acid to arachidonic acid at all, and this is why arachidonic acid is essential in their diets. And dogs and cats are not good at converting ALA to EPA and DHA. In fact, dogs are very poor at it, and cats, it's virtually non-existent. So if our goal is to get EPA and DHA into their diets to provide these anti-inflammatory benefits or modify disease conditions, then we really need to supplement them with EPA and DHA directly in their foods.
Is there an age limit? I mean, how young would you start a puppy or a kitten on an EPA or DHA supplement?
Well, we know we have the minimal requirement, that is provided for the youngest of the young there. But then, we're already proactively thinking about, especially like rapidly growing large breed dogs could be prone to developing arthritis very early. So for me, I'm proactively adding in an anti-inflammatory dose of omega-3s for those dogs. So I may start a little lower in the dosing for the younger pets. So at the lower ends, we're getting the skin health benefits. A little higher than that, we might start to move into, prevention of inflammation for joint disease. And then really I'm tailoring that specifically for that individual pet. So I can make an indication really for the youngest dogs as well as the adult maintenance, all the way into the senior dogs.
What are your dose recommendations? And I realize this can probably really vary whether you're using it more proactively or if you're actually using it at a therapeutic level. Is there a certain dose range that you could recommend that would be considered?
Yeah, so we actually have recommendations for disease conditions, and that's a published peer-reviewed studies have been done that we have a compilation of that was done by Bauer, and so that's probably our primary reference for that. But we generally think of the anti-inflammatory dose, which covers a lot of conditions, to be somewhere between 50 and 150 milligrams per kilogram per day. So I'm really starting them around the 50 milligrams per kilogram per day, but then I might be working up to 100 milligrams per kilogram per day, depending on how I feel about that individual pet. So skin health might be a lower dose than 50 milligrams per kilogram per day. You're going to see that dosing on different products might be less than that, but generally that's where I start them.
Do you ever worry about any kind of potential adverse effects?
Yeah, adverse effects should be always considered for any supplement or medication. I would say generally, I feel the omega-3s are very, very safe, and the vast majority of my patients really do quite well with them. Probably the most common thing I might see is a little bit of GI or gastrointestinal side effects. And this is a reason maybe to start at a lower dose and kind of work up over a period of time to your targeted dose. But if I see anything at all, maybe a little bit of stomach upset, a regurgitation, a little burping, just like people can have with fish oil supplements too, dogs can do that. I always make sure I give it with a full meal so that it's diluted into the food as the best way to administer it, and then just giving it some time. So that would be the most common thing, maybe soft stools, diarrhea certainly is possible. And then at the higher dosing levels, then we start to worry about potential effects on platelet function or immune, function. Wound healing can be affected potentially. These are theoretical in most cases, but it might be something to think about, especially if that pet is already on other medications that impact those same pathways.
Are there any preferred routes of administration? There are so many different products out there that come in multiple different forms. Have you found, because you use them in so much of your patients, that you prefer one route over another?
Yeah, well, that's a good question. I think, it's always an individual thing. I really, I like the soft gels because of the ease of being able to give it like a medicine, but then you might also be able to like puncture it and squirt it into food. Cats are always a special case. So it's really figuring out some cats just love fish oil, and then it's really easy because you can add it directly into their diet and it's no big deal. But some of them you do have to give as a medication, more like, administering like a pill form. And then every cat's a little different on how easy that may go. So I can't say that I really base it on the patient. I don't have one favorite way.
Fair. That's fair. How about the sources of the fish oil? Do you find that there are some animals that may react to certain sources? I mean, do you sometimes have to look for more of a novel protein source of those omega-3s?
Yeah, so in theory, fish oil should be pure and should not contain proteins from the fish. I think depending on the quality of the product, our hope is that there's minimal or no fish protein in there. And protein is really what drives allergic responses. That's what the immune system connects with and creates that cascade of reaction from. So in most cases, I feel even pets with fish allergies can take fish oil. And fish oil by far is the most convenient, the most cost effective, the easiest to obtain. So I will start there. And they really have to convince me that they don't tolerate fish oil. Okay. So beyond that, so if I am convinced that they won't tolerate fish oil, then I might look to other sources like krill or calamari. Hopefully one day we'll have a more marine algae-based oil. We do have algae-based vegan oils we can use. They're generally less concentrated. And so what happens then is you're giving a larger volume, which can be a negative. So again, it goes back to, I really feel like starting with fish oil is best in most cases and usually pretty well tolerated.
So, talking about supplements, and we know there are so many different supplement options out there when it comes to the omega-3s that are available. Does quality play a role in your choice as far as what products you recommend for your patients?
Definitely. I think it's really important to get a good quality product. We have concerns, of course, and you're going to get questions from clients you work with or other people about the quality of the product. So, screening for heavy metals, PCBs, dioxins, the same testing's done for all the human fish oil supplements should also be done for the pets. And then making sure it's a pure product, as I mentioned, I think that's a really good thing to make sure you're dealing with a company that you're comfortable with.
What are the common questions you get regarding omegas from pet owners? What questions do they have?
I find myself so often proactively recommending them that I'm the one doing most of the explaining. I feel like people sort of understand the benefits of omega-3s in general, but most of the time they just don't realize there's opportunities to use it in all different disease conditions. So I think it comes to you mostly as arthritis or maybe allergies. But beyond that, a lot of clients have not really made that connection yet that, hey, we can use it for all these other things. And that might be a strategy in managing whatever's going on.
Yeah. Yeah, because I come from a family of animal lovers, dog and cat. I feel like my role as a pet owner is largely influenced by what I saw my parents do growing up. And so, for example, for me and my dog, he has a lot more issues with his dental health than our dogs growing up ever had. So I have to I never saw my parents brush their dog's teeth. I never saw them put stuff in the water. We never, as far as I know, took the dogs to get dental cleanings. I have to do all of those things. And
Yep.
so I feel like I wonder if that's the case for other people too, that if they're not familiar with the idea of doing anything with their pet beyond just buying them, affordable food from the store, if they how much they kind of have to be coached into or
Right.
educated into understanding what the problems can be and what the value is of this type of supplementation.
Yeah, I definitely think that is the case for a lot of clients that you probably will come through in the general practice scenario. I think so. My nutrition clients are special, right? By the time they get to me, they have done, a lot of them have done some extra work and in investigation on options. Some of that too, though, I think now, like for you, compared to your parents, these are our family members. And we really want to take the best care of them. We want them to have optimal health. We're not just doing baseline, care. And I think that has really changed over the last 20 to 30 years, where our pets are our children now, and we want them to have the best of everything. Whereas before we had less education, less information, less options. So that's some of that. I think that we know so much more and we know how to do a better job. And so now we're telling you, yes, you have to brush your teeth and you have to do the water active, because we're gonna impact that dental health and do better.
Yeah.
And that's the same is true with supplements. I mean, this is where we have baseline diets. We have what we call average commercial diets, really. And so we can do better than that by adding certain nutrients in, and omega-3s is definitely one of them.
Yeah. I think too, I think you're so right with the way that pet ownership has changed
Yep.
with the next generation, I guess, and then we do know scientifically a lot more. I mean, that's probably true across the board with nutrition science in general, but I feel like with the research involving animal nutrition is always going to be several steps behind human research, just because of
Yep.
I guess priorities. How is that a roadblock for you when you're trying to kind of understand what the science is out there as far as quality or dosing or health conditions?
Yeah, so we sort of relate to the tiers of evidence, right? We'll look at studies in all species. Well, first it starts with the lab testing, in vitro studies that are done on cells or in cultures, and we'll get information from that. And then it expands upon that to other species. And we can draw information from that, as general mechanisms. But there's always going to be a question as how that directly relates to our dogs and cats specifically. And I think the more information we have, the more studies that are done, before that, the more evidence we may have to say, well, this seems to be across all species. And I think that's true for omegas. Across all species, we see these same pathways are affected, and we can see reduction of inflammation. But yes, my preference would be, 100%, I would like to see a study in a dog for that purpose, to be the strongest level of evidence and comfort, knowing, it's safe and it's effective and it's going to make a difference. But the reality is probably financial in most cases. We just don't have the interest, the money to fund studies like that. So we need to make choices. We need to draw upon the breadth of information that's available to us across all species to make decisions.
Yeah.
Well, this is all great information. I really appreciate you spending some time with us today talking about the importance of omega-3 and how the addition of the omega-3s to our pets, whether it be from their diets or from supplementation, can be really beneficial. So thank you so much, and we look forward to talking to everybody next time.
Thank you again.
For more education focused on holistic veterinary care, visit WholisticMatters.com for articles grounded in the expertise of veterinary professionals. That's holistic with a W.